Welcome to UMCC Medical Consultant Connectors, where your health matters us. Imagine a small crack in a bone. It's not a complete break, but a tiny hairline fracture. That's what a stress fracture is. It's a small crack that can cause significant pain and discomfort if not treated properly. It's not like breaking a bone from a fall or a sudden impact. Instead, it happens slowly over time from repeated stress and overuse. Think of bending a paperclip back and forth. Eventually, it will break. This is similar to how stress fractures develop in bones. Stress fractures are common in athletes who engage in high-impact activities. Runners, dancers, and gymnasts are at higher risk because they put a lot of repetitive stress on their bones. They put a lot of stress on their bones through intense training and repetitive movements. But you don't have to be an athlete to get a stress fracture. Everyday activities can also lead to these injuries. Anyone can get a stress fracture, regardless of age or activity level. It can happen to anyone who puts repeated stress on their bones. They can happen in any bone in the body, but are most common in weight-bearing bones. The most common places for stress fractures are the feet and legs, where the bones bear the most weight and stress during activities. Stress fractures happen when muscles get tired and overworked. Tired muscles can't absorb shock well, leading to increased strain on the bones. This means more stress goes to the bones, which are not designed to handle such repetitive impact without adequate support. Over time, this stress can cause tiny cracks, known as stress fractures, to develop in the bone. There are many things that can lead to stress fractures, and understanding these factors is crucial for prevention. Overtraining is a big one. Pushing your body beyond its limits without proper conditioning can be harmful. Doing too much too soon puts a lot of stress on your bones, increasing the risk of fractures. Not having enough rest is another problem. Rest is essential for recovery and bone health. Your bones need time to recover after exercise. Without adequate rest, they become more susceptible to injury. Poor nutrition can also weaken bones. A balanced diet is vital for maintaining bone strength. Calcium and vitamin D are important for bone health. They help in the formation and maintenance of strong bones. Some medical conditions can increase your risk of stress fractures. Osteoporosis makes bones weak and more likely to fracture. It's important to manage this condition with medical guidance. Eating disorders can also weaken bones, making them more prone to fractures. Proper nutrition and medical care are essential. Catching a stress fracture early is important. Pain is the most common symptom. It usually starts gradually. You might notice it during or after activity. The pain might get worse over time. It might even hurt to walk. Swelling and tenderness are other common signs. You might see bruising around the area. If you think you have a stress fracture, stop activity. Continuing to exercise can worsen the injury. It's important to see a doctor for diagnosis and treatment. Section 4. Getting the right diagnosis. Your doctor will ask about your symptoms and medical history. They will also do a physical exam. This helps them pinpoint the location of the pain. X-rays are the most common way to diagnose stress fractures. However, they don't always show stress fractures in the early stages. Your doctor might order other tests. A bone scan or MRI can show stress fractures more clearly. These tests can also rule out other conditions. Section 5. Treatment and recovery. Giving your bones a break. Treatment for a stress fracture depends on its location and severity. Rest is the most important part of treatment. This means avoiding activities that cause pain. You might need to wear a walking boot or crutches. This helps to keep weight off the injured bone. Ice can help reduce pain and swelling. Over-the-counter pain relievers can also help. In some cases, your doctor might recommend physical therapy. This can help you regain strength and flexibility. Section 6. Preventing future fractures. Keeping your bones strong. Maintaining strong bones is crucial for overall health and well-being. The good news is that stress fractures are preventable. By taking proactive steps, you can ensure your bones remain resilient and healthy. Start by choosing activities that are right for your fitness level. It's important to engage in exercises that you enjoy and can sustain over time. Gradually increase your activity level. This helps to avoid sudden stress on your bones and muscles, allowing them to strengthen progressively. This gives your bones time to adapt. Consistent, moderate exercise can significantly improve bone density and overall strength. Make sure you're getting enough rest. Adequate sleep is essential for bone repair and growth. Your body needs time to recover after exercise. Cooling down and stretching can help prevent injuries and promote muscle recovery. Eat a healthy diet rich in calcium and vitamin D. These nutrients are vital for maintaining bone density and strength. These nutrients are essential for bone health. Incorporate foods like dairy products, leafy greens, and fish into your diet. Talk to your doctor about bone density testing. Regular checkups can help detect any issues early on. This is especially important if you have risk factors for osteoporosis. Early detection can lead to better management and treatment options. By taking care of your bones, you can reduce your risk of stress fractures. Incorporate weight-bearing exercises and activities like yoga to enhance bone strength and flexibility. UMCC, your ultimate medical consultant connectors.